And yes, one of the points that we did want to cover today was the across-state line purchasing of insurance. You've alluded to that a couple of times and mentioned that you felt like we were close on that issue. I think that there are some very important structural differences in the way we approach this, just as I think that there are very deep philosophical differences in how we approach health care reform. Now, a lot of the people that I talk to want us to start over in this issue, and they want us to give them the ability to hold insurance companies accountable. One of those ways is through very robust competition. And when you have a district like mine in Tennessee where the bulk of our constituents are within 15 miles of a state line, the ability for those individuals who have families and live and work and have employees on the other side of the state line who shop for major purchases every day is to allow them to be able to make those purchases. Also, when you talk about holding insurance companies accountable, if you want to empower patients in front of those insurance companies, take the power away from them, then give them the ability to buy a policy that suits their needs. They are really tired of paying for coverage they don't want. If you want to prevent premium acceleration, such as the issue in California right now, where the premiums have gone up 39%. If you are siding with protecting those insurance companies and not allowing across-state line competition, then what you're doing is denying Californians the ability to go to Oregon where they could buy a policy for 25% less, or individuals in New Jersey who could go to Pennsylvania and buy a policy and lower their cost 26%, or go to Wisconsin and buy one and lower their cost 74%. Now, some of the very differences in our bill, we have a way to do this without putting a federal bureaucracy in charge of it. States can already do compacts, but the Senate bill legislation would require state action and then federal approval for those compacts to take place. There's another important point here. The bill that you all are proposing would not put these in place until 2016. And quite frankly, I think a lot of the American people agree with us that care delayed and access delayed as care and access denied. And they would like to see those, basically what you have, state lines right now basically have stop signs up. When it comes to across state line access, they would like to see that come down and like to see those access portals opened up so that they can first lower their cost, secondly, so that they have greater ability to hold insurance companies accountable, and then also state legislators, even some of our governors, many of the governors favor approaching this model and allowing our constituents a way to access this, get the cost down. And I will be brief so that we can move on to other topics. Thank you.
Well, I appreciate that very much, Marcia. Just to close, because there have been two issues that were raised. One, the purchasing insurance across state lines, and the other was the issue of the mandate. And I just want to address those very briefly, and then I'm going to turn it over to Joe. I support the idea of purchasing insurance across state lines. And you're right that the way we structure it is to have compacts between states so that you start getting a regional market.